This is an honor for me to be here and talk about Tel Franklin. He is one of the best doctors I have ever been attached to.
The future of healthcare is now on the Monterey Peninsula. Tel Franklin, MD, has developed a state-of-the-art medical group that embraces the technological advances of the 21st century and delivers that care in a friendly environment filled with compassion and attention to detail while celebrating the human spirit. In this program, you'll meet Dr. Franklin, hear what his patients and other doctors have to say, and learn how you can get started on the path to an enhanced healthcare experience. Now, here with Dr. Franklin is your host of the program, Ms. Hannah Gordon.
Hello everyone, I'm Hannah Gordon here with my favorite Monterey doctor, Dr. Tel Franklin. Welcome. It's so refreshing to meet a doctor who's so passionate and enthusiastic about his practice. Physicians today are on the front line of healthcare, and as you know, the first step to staying healthy and being healthy in life is to have a physician who knows you. Dr. Franklin, what would you say makes your practice so different?
Well, first let me say it's nice to see you again,
Thank
and
you.
thanks for having me on your show. I think what makes my practice so unique is that patients' experience with healthcare is different. It's an enhanced experience of going to the doctor, of having Tel Franklin as their physician. For example, appointments all start on time. There's unlimited time, so you can bring that list. I'll go through all the questions with you, and then again, I'm there for you 24/7. So if you've got a question at 6 o'clock on Sunday night, 10 o'clock on Monday evening, you call me, I'm there for you. I think what it's about really partnering with patients so that we can really get excited about all the problems and concerns that we can prevent from occurring. If you really think about it, 85% of heart disease, diabetes, and cancer is fully preventative. Additionally, there are new diagnostic studies that can be done to find cancer, heart disease, and diabetes at the earliest stages. But we really don't avail ourselves to that. That's what my practice is about, is giving people that personal touch, but also using the most up-to-date technology to get them in the best shape as possible and keep them in the best shape.
Now, why are you so passionate about what you do? I think just today, it's so hard to find a doctor that really is enthusiastic and has concerns about its patients. Where do you kind of pull that from, that you're just so passionate?
Well, if you really think about it, Hannah, people come in every day and they sit and they talk to me about the things that are dearest to their heart, their health, their well-being. And I feel privileged that people trust me and that people share with me the most intimate details of their lives. And I think that's a real sacred relationship. It's a sacred dialogue, and it actually adds meaning to my life, or I should say more meaning to my life, that people trust me with that kind of relationship, that kind of dialogue, that kind of rapport. And I just feel if I can help somebody prevent diabetes, cancer, heart disease, help people live longer lives, and you do the appropriate diagnostic steps to get people healthier, that's what healthcare should be about.
Yeah. And how do you interact differently with your patients?
Well, each appointment that they come in starts on time, and I encourage people to bring in their list of questions that they have, and we go through each one. And what we do with that list is we figure out a plan. We figure out a plan so we can become proactive and practice preventative health care and help people get above the curve. Heart disease, chronic illness, diabetes, most of that can be prevented. So my job is to partner with them, to be the captain of the ship, and to get really excited about all the diseases and problems that we can prevent from ever occurring. That's what preventative health care, that's what personalized health care is all about.
Now, how would our viewers get to know about your unique healthcare experience?
To really experience personalized healthcare and to be part of the practice, I encourage the viewers to come in, spend 20 or 30 minutes with me, make an appointment, free consultation, and see whether or not if my practice is right for them. Everyone has different expectations, and we want to make sure that we can exceed your expectations. So come in, we spend 30 minutes talking about what your concerns are, what your challenges are, but more importantly, what your goals are. And then we decide whether or not the program's right for you.
Fantastic. Well, we had the opportunity to speak with some of your patients earlier about their experiences, which we'd like to share with our viewers. And when we come back, we will talk more on the life of this family physician.
Well, other offices don't really pay that much attention to the patient that much. I mean, it's very clinical, in and out type of thing. But with Ryan Ranch, I really feel like my needs are being met, I'm being listened to.
I first met Dr. Franklin in 1997. I was having a knee problem, could have been overuse. But anyway, I was thinking I was going to get cortisone or something, and he said, "Had you considered acupuncture?" I said, "I've heard about acupuncture, but I didn't know anyone who did it." And he says, "Well, I do it." I said, "Well, yeah, sure, I'm game." So he did acupuncture on my knee. He said, "Call in a few days and tell me how much it got better." And then I did, and actually I talked to a doctor on the phone, Dr. Franklin, and sure enough, I made another appointment and my knee got better. Every time I call in to get an appointment, I get it on that day or whenever I want it, and Dr. Franklin is always on time. When I come in to see him, really listens to everything that I say. He's attentive, he listens, he is proactive in my health. He's a quarterback, he helps me wind through the system. All my questions are always answered. I know that I'm in the best hands, and he keeps up on all the current things that affects my health and other people's health. I couldn't be happier. He honestly is the best doctor that I have ever had in my life.
Everyone deserves a family physician who really knows you inside and out, keeping you healthy, physically, mentally, emotionally, in every way possible, so you can get excited about all the medical problems you can prevent from ever occurring. That's what optimal health is all about. Everyone deserves to have a physician that's their advocate, who's there for them 24/7. Call us, Ryan Ranch Medical Group, 647-3190. Let us be your partners in health and well-being.
Welcome back. I'm here with Dr. Tel Franklin, and I wanted to ask you just a few more questions here. When I walk into your office, like I did this morning, the positive energy is so palpable. Why do you have such a positive feeling in your office?
Well, I think that's because we're really a team, whether it be the receptionist, the medical assistants, and the other physicians in the office. We really work together. There's a common bond in that we all have a common purpose, and that's really to contribute to the lives of other people. So people come in, they're sick, they've got healthcare concerns, all kinds of challenges, and it's our job to give them hope, to help them heal, and to make them feel better. And it's really important in a professional medical office to give off and to exude positive energy, because regardless of what's going on with anybody, you always want to give people hope, and you always want to give people a smile, you always want to give people a hug. That goes a long way.
Yeah. And when people are looking for a doctor, what are some questions that they could ask?
That's good. You know, I really think that everybody should have a primary care physician, you know, whether it be a family physician or internal medicine doctor. I think the idea of going to an urgent care for your knees just doesn't work, or the emergency room, unless you're having a heart attack or a stroke, or, you know, you're in a bad car accident. But on a normal basis, you should have a family doctor that you should partner with. And I think the most important thing is, do you like them? Do they listen to you? Do you have a good rapport? And so I often encourage patients to make an appointment, just to come in and meet them. And you know how it is, it's like doctors are like anybody else. Do you like them? Do you feel comfortable with them? Do they allow you to ask questions? Then the other questions to ask are you board certified? Are you on staff at the local hospital? And then ask around town, ask your family and friends who they go to. I think that goes a long way, somebody's reputation.
Yeah, and what exactly does board certified mean? And should people be looking for a physician that is board certified?
Well, board certified means that you went to medical school, you got your MD degree, and then you did additional advanced training in either internal medicine, family medicine, maybe you went on and did a fellowship in cardiology or pulmonary medicine. So it means that you went through additional postgraduate training and then you took exams. And here's the key point, you passed the exams.
Yeah, that's a good thing.
And then additionally, the boards like the American Academy of Family Medicine requires us to take 50 hours a year in order to keep board certified and to keep current. And over our election period, which is 7 years, to have at least 300 hours.
Great. And I noticed that you have a book here. Can you tell us a little bit about your book?
So my book is called Expect a Miracle, You Won't Be Disappointed. And the purpose of the book is really a way that doctors and patients can really form a partnership, and where physicians could really peer into the individuality that makes somebody unique. And so what I ask patients to do is to spend a half an hour, 45 minutes, or even 2 hours writing down what their concerns and what their challenges are. But here's the key is, we change the focus. We change the focus from illness and sick care to wellness and health care. You get that? Health care. The idea is that when you change your focus, it changes everything about you. When you're always focused in on diabetes, heart disease, cancer, you become your heart disease, diabetes, and cancer. But if we can change that focus away to really saying, yes, I may have heart disease, diabetes, or cancer, but I'm a living, spiritual human being, and that's just a challenge I have. And here are some unique opportunities, some real passions that I call from within myself, that I can meet that challenge and exceed the expectations.
Great. And I've noticed that you happen to look very fit. And are you do you work out? Are you naturally fit? How do you stay so lean?
Well, I do what I tell my patients to do. You know, I shop and eat healthy. I eat at healthy restaurants, and I work out almost daily. It's important to do what you preach. If you talk to your patients about exercise, it's important for you to do exercise. If you talk to people about the importance of eating fresh fruits and vegetables, organic sources perhaps, then it's important for you to do that. So I walk the walk, I talk the talk, and talking to people and being spiritual is also important. You know, as humans, we are spiritual beings. So recognizing our spirit, recognizing what makes us unique, and celebrating that passion. I really do believe that life is a miracle. We're really put here to really contribute to the lives of others. And I try and do that every day.
Wow, you're such an inspiration. We all appreciate it. We'll be back in just a couple minutes with more on Dr. Tel Franklin's medical practice.
Being overweight is really a medical challenge, and therefore you should see a physician so that you can understand your metabolism and understand how you can combine carbohydrates, fats, proteins, so you can optimize your health and lose the appropriate amount of weight. To really achieve lasting difference and to get as healthy as humanly possible, you deserve the best. Call 647-3190, Ryan Ranch Medical Group. Let our physicians be there for you.
I feel really happy about my weight loss at the moment just because I was able to put on clothes, or skinnier clothes I should say, because I think I was hiding my body a lot, you know, just buying bigger clothes, not really thinking about the fact that, you know, you're gaining weight, you know, so I was just kind of hiding my body. But now I'm able to buy skinny jeans and shirts that actually show off a figure, and it's really nice to walk around with your head a little bit higher. Me and my husband have been always, you know, lovey-dovey, I guess you can say, but ever since losing the weight, I think he was the first one to notice my body changing before I did. And all the time, every time he sees me just walking around, he's like, oh, look at my skinny girl, and, you know, he's always wanting to touch me. I mean, it was always like that before, but it just seems a lot more like he's proud of me, you know, that I've actually accomplished something that I really wanted to do. So, and that's always a good feeling.
In addition to providing medical-assisted weight loss, Ryan Ranch Medical Group offers aesthetic services including Botox, Juvederm, and state-of-the-art laser treatments. For more information on these services or Ryan Ranch Medical Group primary care services and personalized medicine, call 647-3190. An enhanced experience of healthcare for your family the way it should be. Healthcare at Ryan Ranch Medical Group.
4 years ago, I decided to make a change from where I was working in the emergency room at Community Hospital, and decided to leave the emergency room, and I was looking for a place to come. So I heard some good things about Ryan Ranch Medical Group. And I know that Dr. Franklin has been the owner of Ryan Ranch Medical Group, but I used to work with him. So I called him and I asked him, I said, why don't you come to lunch with me one day? And he said, well, why don't you come by the office and we'll talk about that. So I decided, okay, I'll come by. On my next day off, I came by the office, walked in the office, and I went, oh my gosh. I said, this office has some real positive, palpable energy. And I was greeted at the door by some pretty familiar faces that I had known for quite some time. And I just walked in and said, this looks like a really nice place to work. And having been in private practice for many, many years prior to my last employment, I was just like walking back, taking a step back in time, back into my old practice. So that's why I'm here at Ryan Ranch Medical Group, and I enjoy being here.
I've been around a number of years, and over the years I've dealt with a lot of physicians. And I can honestly say that I've never felt that I had a doctor that was interested in me as a total person. Typically you go to see a doctor, and if you have a problem, he addresses the problem, or he thinks he addresses the problem. When I meet with you, I just have this sense that you're thinking about everything about me, what could be going on in my life, what else could be really affecting me than something I think is the real problem. And the other thing in dealing with you, Tel, is typically when you deal with a doctor, there's the doctor and there's the patient. And there seems to be, he's behind the desk and you're this little school kid waiting to hear the wisdom from on high. But my experience with you has always been that we've been collaborative. When we talk about things you want to do for me, you ask my opinion. Do you think this will work for you? So I feel like I'm involved in the process of getting well. And that to me is very important because it shows that you respect me as an adult as much as I respect you as a physician. And that means a lot to me. In terms of availability, that's never been an issue. I mean, if I call and I have a problem, you say, come in. You've come in on a Saturday, on a day off, with 20 minutes notice. We show up at the office and you're there waiting for us. And there's no amount of money in the world that can pay for that kind of service. And the feeling of confidence that you really care about me as a person, not just the cold or the problem I'm having. Because every time we talk, we may talk about the reason I came there, but we also talk about other things peripheral to that. That's part of my life structure, whether it's about myself, my relationship with my family, do I miss my kids? There's an attention there that you don't normally get with physicians, and that's so well appreciated.
This is an honor for me to be here and talk about Tel Franklin. He is one of the best doctors I have ever been attached to. And like my husband said, to be able to call you at any time and find that you answer your phone, or if I need an appointment right away, you're there for me. And I think one of the things that I like about you is the fact that you're a wonderful diagnostician. I can talk to you and you're sitting there listening to me and you come up with answers. You really do. You have answers to my problems. And so many times doctors don't do that. They sit and look at your paperwork, or they look at a computer, but they're not looking at you as a patient and listening to you and listening to what you are saying. And you always do that, no matter how busy you are. So it's been a real pleasure being with you.
I know we spoke earlier with some of your patients where they expressed their experiences in a tutorial. How does that make you feel looking at those videos?
Well, it makes me feel good. It makes me feel good that my patients have value, that they see the value in the program, that we're really making a difference in people's lives, that people are living healthier, and then we're really getting excited about the diabetes, the cancer, the heart disease, or chronic diseases that we're preventing from ever occurring. And I think that's what healthcare should be about. It's really not about sick care. It's not about just going to the doctor with yet another problem, but we can get ahead of that curve. We have the diagnostic studies, we have the intellectual knowledge, the medical knowledge nowadays to really partner with patients and get really excited about all the problems and concerns that can be prevented. And if you think about it, health is really your key to really enjoying and getting most out of the miracle that life is.
He's taken me through something that was a life-threatening illness and identified something that I don't think any other doctor would have. And because of that, I have 100% reliability in him.
Everyone deserves to have a physician that's their advocate, who's there for them 24/7. Call us, Ryan Ranch Medical Group, 647-3190. Let us be your partners in health and well-being.
One of the favorite things about going to the doctor, to Ryan Ranch, is dealing with Dr. Franklin himself and all of the staff. They're so professional, they're courteous, and what's really wonderful, no matter how bad I feel going in, when I come out I feel great because I'm leaving with a smile on my face, either something that Dr. Franklin said, he's even given me a hug before on my way out, and he feels like family. And what's really neat, it also feels like I have my own private physician at the tip of my fingers, just a phone call away. That gives me peace of mind that I can't even explain, and not just for myself, but for my whole family. And my family's my primary concern. And Dr. Franklin just really gives me that peace of mind with the personalized care that he gives us, and just the feeling we get when we go to Ryan Ranch Medical Center.
With personalized health care, you come in, we have as much time as you take, and we really listen. We listen to what your healthcare concerns are and what challenges you face and what you really want to achieve. And my goal is to really partner with every patient that comes in so that we can exceed your expectations. We actually map out a personalized wellness plan with benchmarks along the way so that we can make sure that you achieve health in every aspect of your life. That's what personalized healthcare is about.
Part of being a patient of Dr. Franklin's gives me the peace of mind of knowing that once I call with whatever medical concern I have, it's within, he gets right back to me, or he answers the phone. I have called him at his home late at night and shared a concern, and he put my mind at ease. He told me what I needed to do, and the next day he actually called and followed through on, followed up with me. It's just a peace of mind knowing that what I need, he's going to be there to reassure me.
Dr. Franklin takes plenty of time, and I don't have to wait in the outer office for half an hour to get in. That's the main thing that I like. And when I get through with the diagnosis, I know that he's telling me the right things.
As a caregiver taking care of Perry, who's 95 years old, he's had a number of physicians that he's had to see, and now we just come to Dr. Franklin, and he really takes care of all of them instead of us having to go to multiple physicians. So we know we can go in, we can ask any question having to do with medication, having to do with how he feels, having to do with things that we may be needing to look for. Dr. Franklin has all those answers and gives us good advice that we feel comfortable with.
Well, I was in your office, as you know, earlier this morning, and I had a chance to walk around. And I just have to ask, what is with the dogs on the walls? I mean, I personally, Dr. Franklin, I love dogs. I rescued a dog. And so, you know, I'm all about it. But tell me, what's that all about?
Well, I do have 3 dogs. Spanky, Nellie, and Bandit, and they are all Queensland Healer rescue dogs. And I just think that animals have a way of enriching your life. Certainly, it's not for everybody. Some people have allergies, and other people have other contraindications to having animals. But I'll tell you something. I don't know what life would be like. It would kind of be like watching black and white TV instead of color TV. It just wouldn't have that oomph to it. I just love my dogs. I take them for walks, and they're an intricate part of my family, and they teach me so much about life and teach me so much about unconditional love.
I love it. Well, we are here kind of at the conclusion of our interview, and I wanted to just ask if you would leave our viewers with a message, you know, from you, from the heart, and let them know where they can possibly find out more about your medical practice, if you have a website, how they can kind of stay in touch with you.
Thank you, Hannah. It's really important for each one of us to have a personalized healthcare physician, either a family doctor or internal medicine doctor, someone who's available to you 24/7, someone who really listens, someone who really knows you, someone you can trust. And so I encourage you to give us a call and see if personalized healthcare is right for you. My goal is your goal. Your challenges are what we seek to overcome. But more important than that is to really develop a wellness program so we can get ahead of the curve and prevent cancer, diabetes, and heart disease. 85% of chronic diseases are preventable through appropriate lifestyles. So come in, schedule a 30-minute appointment, and let me be your partner in health and wellness. This is Tel Franklin, MD, Medical Director for Ryan Ranch Medical Group.
Great. Thank you so much, everyone. Until next time, I'm here with Dr. Franklin. Have a wonderful day.
With Dr. Franklin, the experience has been great. I'm always dealing with chronic pain, and there's alternative medicine with him, which is acupuncture. I do acupuncture maybe twice a week if I can. We do travel far distance, which is about 50 minutes from our home, but it's worth it to me. I don't take medicines there for pain, so I do the acupuncture. It's helped me tremendously. I like also the atmosphere with him that I can see him at any time. I call him and he's there for me. If it's just for being depressed because of the chronic pain, he's there. I feel like he's part of my family, and it feels great to have someone like him treating me one-on-one when I need him. It's the best.